afternoon, everybody, and thank you for coming. Albertans are counting on our government to deliver timely access to care and the tools that they need to take charge of their own health. And that's exactly why we're here today. I'm happy to be here with Minister of Primary and Preventative Health Services, Justin Wright, Dr. Rob Davies, radiologist and past president of the Alberta Society of Radiologists, and Brenda Hubley, Chair and Managing Director of Cancer Care Alberta, to announce a new option for preventative health care that will soon be made available to all Albertans. One of the most effective ways that we know of to deliver better health outcomes is through early detection of serious illnesses such as cancer. When it comes to treating serious illness, early diagnosis makes everything easier. Treatment is simpler and more effective, and it places fewer demands on the healthcare system. Most importantly of all, patients are more likely to recover if they begin treatment early. And we want to give them as much choice as possible to gain a clear picture of their health status. That's why, starting July 31st, Albertans will have the option to access diagnostic screening tests, including ultrasounds and X-rays, MRIs, and CT scans to start, directly through participating providers. If those tests lead to a new cancer diagnosis, they will be eligible for reimbursement at publicly funded rates. This is especially important when it comes to cancer. We all know someone whose life has been touched by cancer. It's a disease that will affect nearly every family in our province, either personally or through someone that they love. That's why it's so important that Albertans have every opportunity to understand their health status and access care as early as possible. But I do want to be clear about one thing. This new approach complements and strengthens Alberta's public health care system. It won't replace it. Medically necessary care will remain prioritized and publicly funded, as it always has. Albertans will continue to receive the diagnostic testing and care that they need, like routine mammograms and prostate cancer screening, when and where they need it. What we're announcing today is intended to further our overall cancer strategy, expand Albertans' preventative health care choices, and to help support the public system. Early detection means better outcomes and healthier people, and it means more confidence and timelier answers for Albertans and their families when it matters most. That commitment to earlier detection and better outcomes is one of the reasons we recently launched Alberta's strategic plan for cancer to 2036. Our goal is not only to deliver world-class cancer treatment and support groundbreaking research and innovation, but we also want to prevent more cancers and speed up access to diagnosis and care. This announcement is part of that broader work that builds on the significant investments our government is making to improve care across Alberta. We have built the Arthur J.E. Child Comprehensive Cancer Care Centre in Calgary, a world-class cancer care facility with 160-bed capacity, extensive clinical and research space, and integrated specialized services, giving Albertans access to leading treatment and innovative cancer care under one roof. We've invested $280 million through the Diagnostic Imaging and Cancer Care Enhancements Program to expand and upgrade diagnostic capabilities across Alberta. This includes cancer-specific imaging equipment and other critical upgrades, helping accelerate diagnosis, improve outcomes, and ensure Albertans have timely access to advanced technologies for cancer detection and treatment. We have committed an additional $223 million over 3 years to Cancer Care Alberta to hire more oncologists, expand surgical capacity, renovate the Cross Cancer Institute, and enhance supportive care services. And we're partnering with Fertility Alberta and Cancer Care Alberta to launch a province-wide onco-fertility program, helping remove the financial burden for Albertans facing cancer and ensuring that they have the opportunity to preserve their fertility before treatment begins. We are also continuing to strengthen cancer screening programs across Alberta. This includes lowering the eligibility age for women who self-refer themselves for breast cancer screening, expanding access to testing kits for colorectal cancer in First Nations communities, and innovative self-test kits for cervical cancer in underserved populations. We also recently concluded another call for applications for our cancer research for screening and prevention grants. These grants, worth up to $1 million each, support Alberta-led projects to address gaps in cancer care and prevention in rural and remote areas, First Nations and Métis communities. Our government is determined to build a stronger and more responsive healthcare system that works for every Albertan. Thank you, and now I'd like to invite Minister Justin Wright to share more details. Yeah.
Thank you, Premier. Today, we talk about a new option for Albertans to take a more proactive role in their health and to announce the details for preventative health testing. A few things are more difficult in life than hearing the words, "you have cancer." A cancer diagnosis can often affect every part of a person's life, as well as the lives of their family and loved ones. But we all know that with early detection, we can make meaningful differences. When cancer is found early, treatment is less invasive, care can begin sooner, and patients may experience better outcomes faster. That is why prevention and early detection are so important. Albertans know their own bodies. They know when something doesn't feel right. And many have told us they want more options to seek answers sooner. For some, the concern comes from a family history of cancer. Others, it may begin when they notice changes or symptoms that they've found themselves. Whatever the reason, Albertans want more choice in taking proactive steps to protect their health. This initiative will give them another option to act sooner. Beginning July 31st, participating diagnostic clinics will gradually introduce preventative health testing services across the province. Albertans will be able to pay for eligible tests such as MRIs, CT scans, ultrasounds, or X-rays without a doctor's referral. They will be able to contact a participating diagnostic centre of their choosing. They may be able to choose their own tests, their own times, and they'll be able to, and just as they've been able to do so since 2011. The difference? There's no need for a doctor's referral, and if these tests reveal a new or previously unknown diagnosis of cancer, Albertans will be reimbursed at the publicly funded rates. And if cancer is detected or suspected, patients will be referred to a specialist for follow-up and for ongoing care. We recognize that those dealing with cancer diagnosis are already navigating a very difficult time in their lives. That is why patients will have a full year from the date of diagnosis to submit their reimbursement application. The amount of reimbursement will be determined based upon the publicly funded rates. We have also ensured the reimbursement forms are clear and straightforward as possible for Albertans. I want to be clear, this new option will not take away any publicly funded testing. Albertans will continue to receive medically necessary diagnostic tests, just as they do today. Participating clinics will maintain their commitment to patients with physician referrals first. This initiative is intended to add capacity, not reduce or redirect the capacity available for public testing. Alberta is the first in the country to offer reimbursement for preventative health testing, but we will not be the first jurisdiction that has been exploring this approach. During the planning process, we were inspired by similar initiatives in countries that also have a strong public health system, such as Germany, Japan, Switzerland, and South Korea. Their experiences have shown us that additional preventative testing capacity can support earlier detection, encourage investments in diagnostic technology, and complement the publicly funded systems. We believe this approach can encourage investments in new clinics, modern equipment, and add additional diagnostic capacity here in Alberta. Over time, the added capacity may increase further opportunities to reduce pressures on the health system and improve access for all Albertans. Any future expansions of this initiative will be carefully evaluated. We will consider whether additional testing is clinically appropriate, whether it supports prevention and early detection, and whether it improves health outcomes, and lastly, whether it continues to strengthen our publicly funded healthcare system. At its core, this initiative is about giving Albertans more choice. It's about supporting prevention, finding cancer earlier, and helping people get answers sooner, while protecting our public system, strengthening the healthcare system, and taking care of Albertans. Thank you, and I will now turn it over to Dr. Davies.
Minister Wright, honoured guests and fellow Albertans and Premier. I'm Dr. Robert Davies, an Alberta-trained radiologist practicing here in Calgary, serving on the executive of the Alberta Society of Radiologists as the immediate past president. It is my pleasure to stand with Premier and Minister Wright today at this important announcement on patient choice and preventative health testing. As radiologists, we are specialist doctors in diagnostic imaging and image-guided procedures, and we work every day in both hospitals and community clinics to provide Albertans with accurate information and improved outcomes along your healthcare journeys. We know that a timely diagnosis saves lives, protects families, and contributes substantially to the well-being of our patients. As Albertans, we are served by a robust network of more than 130 radiologist-operated, community-based imaging clinics throughout the province, both urban and rural, which already provide more than 60% of all diagnostic imaging services in the province annually. This is more than 4 million exams per year, more than is done in all of our hospitals combined, in fact. Almost all of the tests provided at our clinics currently are publicly funded, with short wait lists and a strong track record of patient satisfaction. This well-established community clinic model we have provides a level of access and choice for Albertans that is unique in Canada, and the new Patient Choice Initiative builds on this foundation to give Albertans even more flexibility to take control of their own health decisions, which is a good thing. As providers, we do continue to bear the responsibility for ensuring that the care we deliver to all patients is safe and appropriate and performed to the same high standards regardless of how you arrive at our doors. We do appreciate the opportunity to collaborate with government on their initiative, respect the willingness to explore new approaches to improving healthcare access, and the courage to try new things, while also listening to physicians like us and other stakeholders on where caution may be warranted. In the coming weeks, we will see these clinics continue to consult and develop strategies to support this new option for patients while ensuring that patient safety and publicly funded care are not compromised. Thank you again, Premier, Minister Wright. I'm now going to introduce Brenda Hubley, Managing Director of Cancer Care Alberta.
Thank you, Premier Smith, Minister Wright, and Dr. Davies for being here today, and I'm pleased to be part of this announcement today. Cancer is a disease that affects far too many Albertans. We know that 1 in 2 Albertans will develop cancer in their lifetime. That reality means that most Albertans will be investigated for and/or receive a cancer diagnosis. At the same time, more people are surviving cancer, and early detection can and does make a real difference in survival. Access to the appropriate diagnostic testing is an important part of helping individuals understand what is happening with their health as soon as possible. Today's announcement gives Albertans another option to access testing, while keeping medically necessary and directed care publicly funded and prioritized. At Cancer Care Alberta, we are focused on advancing integrated care pathways that support clinicians, patients, and families across the cancer continuum, from investigation and diagnosis to treatment and survivorship, or sometimes end-of-life care. This is where strong coordination across the health system matters. Patients benefit when their journey is clear and timely, when information moves appropriately, and when care is linked across testing, diagnosis, treatment, and follow-up. That is the kind of experience we continue to work towards with our partners, all partners across the health spectrum, including both public and community-based providers, focused on the same outcome: better care for Albertans. Combined with the recent announcement of Alberta's strategic plan for cancer to 2036, we are proud to work within a system focused on earlier detection, better access, and better outcomes for patients and families across the province. Thank you.
Thank you. We'll now go to our media Q&A. We'll be taking one question, one follow-up, and a reminder to reporters to please state your name and outlet before asking your question. We'll start off here in the room and then make our way over to the phones. We'll start with our first at the mic. Feel free to go ahead, state your name and outlet, ask your question.
Hi, Carrie Tate from the Globe and Mail. Premier, your government has spent $100 million on 3 addiction recovery centres in Indigenous communities. Those projects are now mired in lawsuits. Subcontractors are claiming that they haven't been paid. It looks like it could be tied up in litigation for potentially years. What is your government doing to ensure that those projects, which are unfinished, behind schedule, what are you doing to ensure that those are completed?
Well, I'm not sure that they're behind schedule or in danger of not being completed. In fact, we're working on the announcements before the end of the year on all of them. What we did in partnering with First Nations communities is that we established a model where they would be able to choose their own contractor. And so they did. And if there are issues that are going to be litigated, that's where it's going to be resolved, is in the court. But we're very proud of our partnership with the First Nations communities that partnered with us. We've already opened up the blood reserve recovery community, and we're looking forward to Siksika, Sutina, Enoch, as well as Métis Crossing opening up before the end of the year.
Will your government put up more money if necessary to finish those centres?
We're not hearing that more money is necessary. In fact, we're hearing that they're going to be completed before the end of the year with the budget that was established.
Thanks, Carrie. We'll go to our next question.
Dane Patterson, the Canadian Press. Thanks for taking my question. Given that you folks are looking at prioritizing the publicly referred ones over the private ones that we're talking about here, correct me if I'm wrong on that, but why not broaden access to healthcare practitioners rather than provide private access?
Well, I would say that an individual will have a pretty good idea whether something's not quite right with them. And in some cases, they'll be able to work with their practitioner to get the test that they need. And in some cases, they haven't been able to secure that. That's part of why we believe putting the power in their own hands so that they can get peace of mind testing is going to be very important. And in the rare incident where cancer is discovered, we'll be able to get them into treatment faster, and that will also be covered by the publicly funded healthcare system. But if we can get somebody in for treatment when they're stage 1 or stage 2 rather than stage 4, it's going to be an easier pathway for treatment and an easier pathway for recovery, and it will save lives. So that's why we're doing it this way, is that we just want to put the power in the hands of the patient so that they can get those peace of mind tests and hopefully get the all clear. But if they do end up getting something diagnosed, we want them to be reimbursed so that they can get directly into treatment.
But why not, kind of open it up to having more healthcare practitioner accessibility from patients rather than having this private kind of angle that people will have to pay for rather than, the publicly funded practitioners like nurses or doctors?
Look, I mean, we could spend 100% of the healthcare budget on diagnostic and never treat a single patient. That's how expensive the diagnostic tests are and how frequent they are. And so we do have to rely on doctors to use their expert opinion about whether they think somebody should seek a diagnosis. And if a person chooses to self-refer, then they can pay out of their own pocket, and if something is discovered, we'll reimburse them. But there does have to be some kind of recognition that the public health system it's not possible. We don't have the money to pay for every single health test every single person would want every single year. There does have to be some deference given to doctors, but we also need to offer the option. If people want to pay for the treatment themselves, we don't want to block that.
Thanks, Dane.
Thank you.
Yeah.
Heather Yerkes-West with Global National. Just curious the size of the bureaucracy needed to process the reimbursement claims, and will this fall under an existing department? Is this something brand new? How will that work?
At this point in time, it'll fall under existing department with existing revenues. There is no ask for additional funding or FTEs. This is building off of a 2011 announcement and program which saw physician-led referrals be able to go through this process. This is just opening up a more streamlined approach with direct to patient access, and with that we're able to build off existing frameworks that are already in place.
And then my next question is for Dr. Davies. You mentioned that you'll be watching the rollout of this carefully. What will you be watching that would signal in your mind a need to sort of retool? What kind of red flags would be out there?
Yeah, thank you for the question. I mean, we have a couple of important things to work out. One of them is that it remains very important that this is done in an appropriate way that protects patient safety while we innovate. And so we have to provide a new service, if you will, which is assessing patients who come self-referred for an exam to assess its appropriateness, what the best test is, and if something is found, to be able to care for that patient and refer them on as needed. So that's a capacity that we have to design and build. We already have some examples for that. So as it stands right now, Albertans can self-refer for screening mammography from ages 45 to 75, and I think within a few months that age goes to age 40. And so we have some experience with it. It's just a matter of expanding that capacity somewhat. And I think some perspective on the scale is important here as well. Private paid imaging exams have been available for decades in Alberta. I think the first MRI opened in 1994, first private MRI. And since that time, the total number of private exams is about 0.5% of all of the diagnostic imaging done in the province. So even if this initiative quadrupled the number of patients wanting to pay out of pocket, it's still a small impact on our capacity and even downstream effects on the system. So we think it's something manageable. We're going to be watching it closely, but we think we have the right design here to deal with it.
Thank you.
Thank you.
I'm Felix from Radio Canada. What's the expected effect on public radiology waiting list?
So the expectation is that physician-referred services will be delivered first with the priority, maintaining our commitment to our publicly funded system. There will be no additional pressures applied to the public system. These testings will take a secondary priority, making sure that we can maintain the need from our priority or from our publicly funded system first.
All right. My second question is on another topic for Premier Smith. Regarding the disappearance and the Amber Alert around Parker Wells, you said law enforcement agents need additional tools when it comes to vulnerable kids with disability. What were you thinking? What kind of tools? Is it a broader Amber Alert or some kind of other alerts?
Well, the specific ask from Calgary Police Service was to be able to issue an Amber Alert, which Minister Ellis gave the approval for immediately when we were asked. But the additional tool would be to leave it to the judgment of police when they would need to use that tool. They shouldn't have to go through an extra step of asking the Minister of Public Safety and Emergency Services if, in their opinion, it would help in aiding of the search. I just want to commend the Calgary Police Service because they reached out to every other level of first responder, including search and rescue, and have been doing an intense search for over a week. I think they've got more to update. I think they're doing a press conference at 1 p.m. today. So I would maybe ask you to put that question to them to see if there is anything additional that they need. But I think that us creating an avenue so that law enforcement can use their own judgment of when they want to issue a silver alert or an amber alert for whichever reason, so that it's not just the narrow area of abduction, then I think that would remove a step and allow them to make a decision on whether or not, and they may choose not in some cases of a missing person, they may choose not to exercise that, but I think we have to rely on the expertise of the law enforcement to be able to make those decisions.
Thank you very much.
Yeah.
Thank you. We have time for a couple more questions. We'll take our last one here in the room, then go to the phones.
Kevin Green from CTV. A couple of times you've mentioned, specifically the doctor here mentioned, a percentage amount of the number of private versus public health. But somewhere along the line, you guys must have run numbers to figure out how many people, not a percentage, but how many people you expect to use this new system once it comes in place. What is that number?
We are expecting somewhere in the range of actually what the doctor had said, about 4 times of what's existing and happening right now. The reason why we started off with cancer diagnosis first was so that we could make sure that we could build out a system that made sense, that was sustainable, and that we could absolutely not overburden additional services that may be required as complementary types of care that would go along with the new cancer diagnosis. Ultimately, we do expect to see an increase in the number of cancer diagnoses, but at a much earlier state than a stage 4 cancer, which can become much easier to treat, much less invasive for the patient, but also delivering on better outcomes.
This isn't my second question. It's a clarification on my first one. Instead of saying 4 times the number now, what's the number?
Yeah, maybe I'll defer to the doctor here.
Yeah, thank you. So the number of private paid imaging exams in the province currently is measured in the low tens of thousands, right? So if it increased by 3 or 4 times, that could be, 50 or 60,000 additional exams. This is very speculative, right? Because we don't have experience with this particular model, and it'll take some time for the capacity to build. But again, the perspective is important that this is in a system that handles 7 million exams a year total right now. So the overall impact of that is relatively small, and we think is manageable.
Okay. And my second question is about the payments. A couple of times it's been mentioned that the government will reimburse on a fee schedule, but private operators will charge as private operators will charge. Is there any way that the government will try to ensure that the fee schedule matches or closely matches the actual charges people will pay?
Well, I'll give you some numbers here because we've got average price ranges right now for private diagnostic services. So the average cost of an X-ray ranges from $20 to $140. Average cost for ultrasound ranges from $100 to $500. Average cost for a CT scan ranges from $250 to $1,000. And the average cost of an MRI ranges from $600 to $1,200. So I'll turn it over to the minister to talk about where in that range the reimbursement would come in.
Ultimately, the private clinics do set their own price, so the cost will vary from clinic to clinic for the types of scans and services that they're providing. Albertans should confirm first with the clinics before moving forward with any procedures to make sure that they agree with the terms. Albertans should also discuss the benefits, limitation, or appropriateness of those preventative testings with those providers before proceeding as well.
Thank you. We have time for one last question. We're going to head over to the phones. Operator, could you put through our first caller, please?
Jennifer Lee at CBC News. Please go ahead.
Hi, thanks for taking my question. This is for the Minister and the Premier. I'm wondering if you can talk us through specifically what steps will be in place to ensure that medically necessary, publicly funded tests are not impacted by this move. And access to them.
Yeah, first and foremost, any clinics that are participating in this must maintain and guarantee the same access that they have prior to July 31st. So any additional services that they take on are secondary exclusively after physician-referred services. So there is steps to make sure that nothing is changing in that regard. The priority and focus continues to protect Alberta's publicly funded system. This is just an additional avenue of choice for limited clinics who offer the private services.
And do you have a follow-up, Jennifer?
Okay. I do, yeah, thanks. You've mentioned the reimbursement applies to cancer findings. It doesn't apply to other medical findings, and why was that decision made?
Yeah, at this point in time, we're moving forward with cancer diagnosis, new cancer diagnosis, or previously unidentified cancer diagnosis first is a priority for us to be able to build this off. If we look at cancer deaths, that's one of the largest chunks of deaths in Alberta. And as it was previously stated, 1 in 2 Albertans will develop cancer in their lifetime. And these diagnoses will allow us to catch it sooner, to make treatment more viable and less invasive for the patients.
Thank you. And that'll conclude today's press conference today. Thanks, everyone, for joining.
Thanks, everyone.
Thanks.